once the measurements were checked, we know to go to intraocular lens calculation. In intraocular lens calculation, we have a wide variety of choices. The data that we just collected with the Aladin can be viewed, revised, and if necessary, changed if we want to take the actual length with a different instrument and we want to incorporate that measurement into the Aladin. We can go into manual and we can enter the actual length using this pad, and once we entered and we press save, the actual length that the Aladin is going to consider for the measurements is going to be the one we entered, not the one that the Aladin measured. Same goes for the anterior chamber depth, lens thickness, central corneal thickness, and wide to wide. In the keratometry, it's exactly the same. We can go with manual and we can change the axis, we can change the K1, the K2, and save the results for the Aladin to calculate based on those results. Intraocular lens calculation allows us to compare manufacturer of the intraocular lens, model of intraocular lens, and one of the 6 formulas that we have presently incorporated into the Aladin. In the list of intraocular lenses, there are virtually all the lenses that are in the market in the United States and Europe. Once we selected a manufacturer, we can select the models of the lenses. And one of the good things of the Aladin is that the model of the lenses can be updated periodically using the ULIB update database. That database will allow us to update all the models of intraocular lenses, removing the ones that have been discontinued and adding the new ones that have been produced since the last update. And finally, we have a number of formulas. The most popular formulas that we have is the SRK2, SRKT, the Huygens, the Hoffer Q, Holiday 1, and the Barrett Universal 2 formula. Any of these formulas can be used with any of the lenses, and you can make 5 different combinations between formula, lens, manufacturer, and obtain a variety of options for your patient. For the toric IOL calculation, we have also the 5 options combining the manufacturer, the model, and the formula. But also we have the target that we want to have the refraction after the surgery, which could be half a diopter. The surgical induced astigmatism that is normally entered by the surgeon according to the type of surgery he's going to perform. And the incision location that is suggested at 84 degrees. Once we select one of the toric intraocular lenses and we select the power, we can go to the next, in where there is a sign that says if the toric IOLs available overcorrect the cylinder, it recommends one of the other lenses that you can use. And in here you have all the information plus some of the available toricities of the intraocular lenses of that particular manufacturer. Spherical equivalent, surgical induced astigmatism, what formula we're going to use, and the incision location. If we want to try a different location, or if we want to change the axis of the location, we can select the lens and then press the rotation simulator. In here, by selecting the different residual cylinders or the residual sphere, we can create the illusion that we are changing the axis of the intraocular lens and see what the results are as far as astigmatic correction and residual sphere. Once we selected the axis, the final axis of the lens, is going to be marked in here, and then you can continue with the measurement, printing out the measurement and obtaining the values for the intraocular lens. When we go to post-refractive intraocular lenses, we have several options. Again, we have torics. We can use the Shamas no history, or we can use the Camelin-Calosi. We select the lens and select the target. And in here, we select we have two formulas, Shamas no history and Camelin-Calosi. If we select Camelin-Calosi, we have to enter the circ value. If we select the Shamas no history, we have to select the lens. And once the lens is selected, we can print and bring that information to the operating room. The Barrett IOL calculator is a combination of 5 different formulas. The Universal 2 formula, the toric calculator, which is based on Dr. Barrett's formulas, the True K formula, which is for patients who had refractive surgery performed before the cataract surgery, in which you have to enter the pre-surgical and post-surgical refractions. The True Toric, also for post-surgical patients, and the RX formula that allows to correct unpredicted results or unpredicted outcomes in surgery by allowing to piggyback an IOL, that means to addition a second IOL into the eye, or exchange the IOL that is already in place by a different one with the correct amount of prescription.